Hello everyone, this is Nicole Freeland, and today we are discussing pharmacology, pharmacokinetics, and pharmacodynamics. These are your objectives for this module. Alright, pharmacology. This is the branch of medicine that is concerned with the uses, effects, and modes of action of drugs. It concerns how drugs enter and travel throughout the body and the responses that they produce. Drugs may cause different responses depending upon factors such as gender, age, health status, body mass, and genetics. Some elderly considerations that we need to keep in mind as nurses when it applies to pharmacology is that weight loss may occur, decreased total body fluid often occurs with aging, an increase in fatty tissue occurs, decreased renal function. These all alter the way drugs are distributed and concentrated within the body. The 4 steps of pharmacokinetics. These are absorption, distribution, metabolism, and excretion. Pharmacokinetics is the study of the way in which drugs move through the body during absorption, distribution, metabolism, and excretion. Absorption is the movement of a drug from its site of administration into the bloodstream. Factors that affect absorption, there are factors within our body and there are factors within the medication itself. These include the surface area available for absorption. Like we talked about during class, please remember the larger the surface area, the more the drug can be absorbed. GI motility, the presence or absence of food in the stomach, the body's pH level, certain diseases, and the presence of other substances. The factors within the medication that affect absorption are lipid water solubility. These are drugs that can cross the blood-brain barrier and the placenta. Other factors of medications that affect absorption are the formulation of the drug itself, the dosage or amount of the drug given, and the chemical nature of that drug. Pharmacokinetics continued. Next is distribution. This is the movement of the drug through the body. Metabolism is the transformation of a drug by mixing and dissolving, which is hydrophilic action, in the body so that it can be excreted. The liver is responsible for drug metabolism. Excretion is the removal of the substance from the body. The kidneys are the organs that are responsible for excretion. Next, we'll move into pharmacodynamics. This is the effect that drugs have on the body. It is the relationship between drug concentration at the site of action and the resulting effects, both therapeutic and adverse. It involves receptor binding, including receptor sensitivity, post-receptor effects, and chemical interactions. Drug and receptor interactions include molecules such as those from drugs, hormones, and neurotransmitters that bind to a receptor site. These are known as ligands. The binding can be specific and irreversible, and a ligand may activate or inactivate a receptor. The activation may increase or decrease a particular cell function. So what are receptors? These are groups of specialized cells. They detect a change in the environment and stimulate electrical impulses in response to that change. The change is directly affected by the stimulus. Next, we'll discuss first pass. First pass includes drugs that are administered orally that must first pass from the intestine to the liver before reaching the general circulation. The drug is metabolized, decreasing the dose before the drug reaches the desired tissues. First pass also refers to drugs that are metabolized by gut flora or intestinal enzymes. Routes that avoid the first pass include intravenous route, the intramuscular route, the sublingual route, and the subcutaneous route. It is important to note that oral medications, because they go through the first pass effect, are diluted and their effect is less than those medications that bypass the first pass effect. Next, we'll discuss different routes. The IV route is the intravenous route. This is simply the route that is delivered into the vein. Drugs administered by this route have a rapid therapeutic effect, and the absorption into the bloodstream is immediate. These types of drugs are good for emergency situations and are ideal for patients who are NPO, which is nil per os or nothing by mouth. These medications must be given over at least a period of 1 minute, often longer. Please be familiar with the IV drugs that your patient is receiving, and please refer to your medication handbook or your Davis drug guide to know the amount of time that a medication needs to be given over. It's also important to note that once an IV med is given, it cannot be retrieved. Once it enters that bloodstream, it is there to stay. If errors occur, such as giving a med too quickly, this can result in serious harm and even death. Next, we'll discuss the IM route. IM stands for intramuscular. This is simply a route that is directly delivered into the muscle. The onset is moderately rapid, so it is quicker than an oral medication, but not as quick as an IV medication as far as therapeutic effect goes. It is used for irritating medications, solutions in oils, and aqueous suspensions. The most common sites are ventrogluteal, dorsogluteal, the deltoid, and the vastus lateralis. Needle sizes for this route should be from 18 to 27 gauge. 22 to 25 gauge is the average, and the needle length needs to be 1 to 1.5 inches long. It's important to remember that the smaller the needle size, the larger bore that needle is. So an 18 gauge needle is larger in diameter than a 27 gauge needle. For an IM injection, these will be injected at a 90-degree angle. The volume that can be given by this route is 1 to 3 milliliters. Some downsides to IM medications are that the patient may experience pain at the injection site. There's always the possibility of tissue and nerve damage, and there's always the possibility of infection at the injection site. So that is why we will always, as a nurse, practice standard precautions when we are drawing up, mixing, and administering medications. That includes washing your hands thoroughly with soap and water, or using your alcohol-based hand sanitizer before you don your gloves. Once you don your gloves, you will then mix your medication and select the appropriate size needle and syringe for your patient. After you are done mixing the medication, you will remove your gloves and you will take your medication that has been labeled with the correct drug, the dose, and the volume, and the date to your patient's room, where you will again clean your hands and don gloves. Then you will cleanse the site of injection and you will administer your medication. Once your medication has been administered, you will dispose of your needle into the sharps container, and you will dispose of your syringe into the trash. You will remove your gloves, and you will again perform hand hygiene. It is important to note that you provide a Band-Aid or a gauze pad with tape to the injection site for your patient so that bleeding does not occur at that injection site, and it also decreases the risk of infection for your patient. These are some examples of IM sites that are commonly used for injection. You see the deltoid site, the ventrogluteal site, which is the hip, the vastus lateralis site, which is the leg, and the dorsogluteal site. As we discussed in class, the dorsogluteal site is strongly discouraged from use nowadays because of possible damage to the sciatic nerve in that area. As nurses practicing in the field, I highly discourage you from using this site. It is not best practice. However, you may still see other individuals using this site for IM drug administration. That is why it is important for you to know where the site is located and to know the possible outcomes of an IM drug administration to that site. Injection angles. Here you see different examples of injection angles. An intramuscular injection should be given at a 90-degree angle. A subcutaneous injection is generally given at about a 45-degree angle, and an intradermal injection is generally given at a 10 to 15-degree angle. What are some factors that affect the angle of injection? These would be your patient's body composition, or quite simply how large your patient is. If they have more subcutaneous tissue, you may use a 45 to a 90-degree angle for subcutaneous injections. If your patient has 10% body fat, which is very, very low. So for your tiny elderly women, you may need to use a 45-degree angle for an IM injection. This is where your critical thinking skills come into play when you are in the field practicing as a nurse. You need to consider your patient's size and the size of the needle that is appropriate for that patient. The sublingual route. Sublingual simply stands for under the tongue. This route directly enters the bloodstream and it bypasses the liver. The onset is rapid because it does bypass the liver. This route of administration is ideal for cancer patients and those who do not have IV access. Subcutaneous is simply under the skin. This route is used for non-irritating water-soluble medications. Needles should be 3/8 to 5/8 inches and 28 to 31 gauge. The injection volume should be no more than 0.5 to 1.5 milliliters of solution. You need to select sites that have an adequate fat pad size, such as the abdomen, upper hips, lateral upper arms, and the thighs. For average size clients, pinch up the skin and inject at a 45 to 90 degree angle, and then for obese patients, inject these at a 90 degree angle. Next, we will talk about agonist medications. These are medications that bind to or mimic the receptor activity that endogenous compounds regulate. So endogenous compounds are those that are found within the body. They produce an effect within the cell. Full efficacy at the receptor site occurs, meaning that these drugs have a full effect. Some examples of these medications are opioids such as morphine, oxycodone, and hydrocodone. Antagonist medications bind to receptor cells and they do not create a response. They can reverse and block the receptor to a natural agonist. They are not reversed by additional agonist administration. An example of an antagonist medication would be Narcan. Lastly, we have partial agonist medications. These are meds that act as agonist and antagonist. There is limited effect at the receptor site. These drugs give a desired submaximal response, and it reduces the overstimulation of receptor cells. To summarize, as the student, you should answer the following questions and be familiar with the answers. That is the end of this module. Thank you all, and I hope you have a wonderful day.